I'd like to discuss two important concepts in FUE, or follicular unit extraction hair transplants. FUE involves the removal of the hairs from the back or sides of the head, or sometimes even the beard or other donor areas, one at a time, without the need for making a linear incision. Thus, there's no scarring, no linear scar. The first concept is sharp punch versus the newer hybrid punches. Sharp punches is the standard technology. It's used still in most of the proprietary systems, including the robot. It's a sharp punch that cuts through the skin. Also, though, with the sharp punch, it can also, if it's not perfectly aligned, can cut through the follicles. Hybrid punches are a newer form of punches that is it basically involves a sharp outer edge, but a dull inner edge. The only surface that contacts the hair follicles upon their removal is the dull inner edge, thus significantly reducing the rate of transection to below 4 or even 3%, as opposed to the sharper punches, which, unless it's perfectly aligned, have a higher incidence, as much as 15 to 20% incidence of transection or cutting of the hairs. Cutting of hairs is not good because that results in a lower rate of regrowth. The concept is sort of best analogized by the instrument that cuts a plaster cast off. The knife only cuts the plaster and does not cut the skin. Well, similarly with these oscillating hybrid punches, there's only the cutting of the outer skin, but no cutting of the follicle. Thus, you get better follicles. Combined with this hybrid punch is the different types of drills. We use primarily the WAD, W-A-W system. It was designed by a colleague of mine from Belgium, and it uses an oscillating as opposed to a rotary system. Oscillating systems also improve the quality of the grafts because instead of rotary, which has a greater risk of damage, the oscillating system is much less likely to cause a transection. You can see in this video where I show on one side you see a sharp punch, and on the other side you see a hybrid punch, and you see as we take the grafts out, you see the improved quality of the grafts obtained by the hybrid punch. Second concept I want to discuss is robotic versus human-controlled extraction of grafts. The robotic system has gotten a lot of press, seems very sexy having a robot. The reality is the great majority of the top hair transplant surgeons worldwide do not use the robot. The robot tends to use sharp punch technology and thus has a higher rate of transection, as opposed to when you have a human touch with a specialist, a physician and his assistants, working with the other types of FUE punches. In our case, we use the WAS system. The rate of transection is less when we're harvesting the grafts, but also we're able to be much more efficient. And as you can see on the video, it's also less traumatic to the area where we're getting the grafts from. And you can see on one side is a showing of the robot, the other side is showing me going ahead and removing grafts using a different type of manual motorized system. In our hands, we like to use an oscillating drill with a hybrid punch. Tends to have the least traumatic extraction of grafts, and thus we get the highest rate of regrowth of our hairs, most importantly, creating the best results for our patients.